The Health Institute for Mother and Child, MAMTA, is one of India's foremost health NGOs and is present in 14 Indian states. It is currently leading an EU-funded project to improve the reproductive and sexual health of young people by increasing the age at marriage and delaying the age of first pregnancy. This is done through youth group meetings with peer counsellors facilitating the sessions. Renee visited a centre in a village in the state of Uttar Pradesh in northern India, where she spoke with young people taking part in these meetings, their parents and the counsellors. There are two groups, boys and girls. Saya is a Hindu goddess. Hindus believe in many gods, therefore some communities select a god that they feel close to. This community favours Saya, therefore the girls decided to call the group after her. Sakti means strength, while Samu means group. When project staff first entered the village, they identified a list of all the adolescents living there. They then called house to house, one-on-one, to invite them to an initial meeting here at the Village Youth Information Centre, to discuss whether they could then start meeting here regularly to discuss sexual health issues. The girls explained that they come here because sometimes they are not able to share certain things with their family members. They feel more comfortable talking among friends about reproductive issues, from menstrual cramps to the changes that their bodies are undergoing during puberty. In the meetings, these matters are discussed and explained. For example, they learnt that menstrual pains are part of the normal cycle. This mother said that she would like her daughter to wait until she is older before she gets married. She believes that if she waits until she is 18 and has a job, then she will find a better husband. If she marries too young, then she will not find such a good husband. Teacher. Her daughter would like to become a teacher. The girls then clarified that in this group they have learnt that they should not marry too young, as this will affect their health and their education. Once they are married, their husbands will pressure them to stay home, to cook and clean. Therefore, if they marry while they are still studying, they will be forced to stop going to school. There are currently 15 boys in the group, and all of them are going to school. The issues discussed during the meetings include early marriage, gender, HIV and AIDS. They use posters, flashcards and other tools, and then the members can ask questions. The boys all know each other well, so they have no problem talking about these things. They have fun and laugh together. They don't feel embarrassed. When the boys bring issues to the group that can't be addressed there, then they are referred to the health centre. If they don't want to go on their own, then sometimes they go with a teacher or with a friend. The boys explain that their families don't give them any problems. They are curious and ask them where they're going and why, what they do there. However, when the boys explain that they take part in discussions and can read newspapers, this is okay. A meeting can last between 2 and 2.5 hours. It takes time to collect everyone, to get everything ready for the meeting, and to sit down and get started. The actual discussions only last 45 minutes to an hour. The boys also have family chores and studies to do, so they don't necessarily come every day, but rather when they can spare the time.
सर जैसे मतलब
पूरा तैयार हो गए कि नहीं चल रहा है तो कब प्लान कर रहे हैं ये तो आपकी तो बताया है ना.
This boy explains that in an ideal situation he'll get married when he can stand on his own 2 feet, is earning enough money to support his family and to also take care of his new family. The boys would like to marry educated and beautiful girls. However, the characteristics of the girls that they marry, age, education, etc., will depend on the families. Both families have to agree to the marriage. The boys did, however, agree that they should not marry a girl who is underage, still a child.